comparisons. One of the things we found is that, like, if you look at the high end use, we all know that there's this group of people who goes from jail to hospitals to homeless shelters to back to jail. A lot of times they have very chronic needs around mental health or substance abuse, or they have correctional backgrounds that make it hard for them to reconnect into community. It's funny when you look at these lists and compare them to each other. It turns out that there's not a lot of overlap as you would think. So that, like the top 100 users in the jail system don't necessarily show up in the homeless system because they've been in jail most of the time, even though when they get out, they probably go to jail for a few days, get rearrested and sent back. Same thing with the hospitals. There's people who spend hundreds of days a year in the emergency room. They're worth literally millions of dollars to the whole hospital system. And they are homeless for all intents and purposes, but they're not showing up in shelters. So one of the things we're really working on right now is trying to figure out who is in each of these different systems. So the data that we're putting into HMIS, we're now hopefully being able to share with these other state agencies to kind of fill in those gaps. How do we tell the homeless providers who really is mentally ill and eligible for more services through Medicaid, and we should be connecting to Medicaid? Who has a parole officer or a probation officer that we should be working with to get them connected. So this data is now not only having an impact on the homeless system, but hopefully in the next year or two, we'll be using it to share with these other systems of care. Just to give you some context, Connecticut did this awesome thing where they asked 8 of their state agencies, their DES, their corrections, their HMIS homeless providers, their child welfare system. They asked each of those groups to provide their who the highest cost users in each of those systems was. And then they compared it. Tell me how bad this is. They had 800 individuals who had been served by 5 of the 6 state agencies. That means they were high cost for their DES, they were high cost in the jail system, they were high cost in the homeless system, they were high cost in the healthcare system, they were high cost in the behavioral health system. We need to figure out who those individuals are, because I guarantee they're the ones either we're missing completely because they're not popping up all the time, they're in these other systems, or they're the ones we're dealing with all the time at a high cost and we need to house. And so again, we're trying to do more work like that in a strategic way on the state. So the work you're doing is not just in the homeless system, but it really has implications across all of our human services and all of our supportive services. Because the same thing that works in ending people's homelessness is the same thing people coming out of the education system need. It's the same services that people coming out of jail need. It's the same services that elderly people need to stay housed. It's the same interventions. We just now have to work across all these systems better. So anyway.
We love it. We love it. We love it. Thank you so much. If there aren't any other questions, I don't know if David's going to just stay on. Hold on. Let me check. Hold on. Or if you guys have any other additional questions for us, we're going to go ahead and include David's contact information when we send out materials to everyone so that they can get direct contact with him if they have any additional questions. But if nothing else, we're going to go ahead and move through the rest of the presentation. David, thank you so much for your time, energy, effort. We appreciate you. Cheers to you. Kudos to you. We're excited to see what's coming down the new year with 8.0 and everything that you guys have got going over there. We're excited.
Yeah, no, it's an opportunity to visit and speak and share a little bit of my thoughts. And like I said, anything I can do to support anybody at any level, let me know. We're again, my true knowledge is knowing what I don't know. And a lot of what I know is talking to people, at every level of the system and learning from everybody at every level in the system. So, like I said, feel free to reach out and share if you think there's something that we can help or bring to light or address. Like I said, I'm humbled by the work and everything that everybody in our system does. So again, any way I can support that, let me know. And I will drop off, but thank you for the opportunity.
Thank you. All righty, so there aren't any additional questions or they're being answered. So we're gonna go ahead and proceed. Can we go through, click the next slide? So I'm going to throw this back to my manager, Fearless Leader, Stephanie Crump.
All right, let me get myself off mute here. All right, all right. Let's talk about a little bit about agency admin and the role that plays here as your staff structure. So there are a couple different things that you can choose when you're requesting a new user. As you'll see on the graphic, there are different responsibilities. There's a standard HMIS user who typically is just going to be entering data. They're going to be either a case manager, they might be audit only where they're not entering data, but they're just viewing, but that's considered like a standard HMIS user. The other user that we have, the other user type is an agency admin. And the differences here is that the agency admin, they have the ability to view their entire agency's data, not just the data that they have an EDA for or an enter data as for. So they can view their entire agency data. The responsibility here is that they're only viewing their agency data. So as an agency admin, you have permission to view your agency's data, do not have permission to go and view other agencies' data. So I do want to make that distinction very clear. Another thing that agency admins can do is that they can reset passwords for their own staff members. So you can go in and reset passwords and not have to submit a ticket to the HMIS help desk. The other thing that they can do is that they can generate reports for their entire agency. This does require an ART license, so that would just need to be indicated, on your user packet that you do need that, but they can generate all of those reports. Again, we want folks to only be generating reports for their own agency. We don't want folks to be generating reports for other agencies and other programs that you are not affiliated with. That is just a responsibility and the accountability that agency admins have. Also, the agency admins are the ones who can request new users and new projects for their agency. If you're not an agency admin and you send us a ticket, we're going to ask that an agency admin resend that ticket. So that is part of the role, is that they are authorized to add new users and projects to their agency. So that's sort of the nutshell, I guess, differences between the two, between a standard HMIS user and an agency admin role. And if you have any questions, please drop those in the Q&A and we will answer those promptly.
Hello. I want to just go over a couple of things, had some questions about visibility, some issues that have come up, that come up actually pretty frequently. Get questions from both agency admins and regular users about visibility. So as the slide says, HMIS visibility is complicated. It's my headache. And there are many things that affect visibility. A lot of what I will go over with an agency admin, I'll show you. I like to, in fact, if I can share, I'm going to take the screen for just a second and pull off the visibility, this slide. Okay. So this is just an example here of what visibility looks like on the inside. So when I'm explaining how a project gets set up, I like to go what's called inside baseball. Slide this to the side so you can see better. So these are many of the sub-assessments. If you look at what these names are, file attachments, client notes, things like that, you'll see a lot of this on your client and summary tabs. There are some things that are universal for most projects. Let me clarify, let me remind, I'm saying most projects. That is, those projects that do not have restrictions on visibility, like domestic violence projects or RHI, runaway homeless youth projects. But most projects will by default share that there is a client, that client exists. The client demographics that you also see on the client summary tab, and the entry exits of that client. What I've done here is I've included some of the coordinated entry projects into this visibility. So global means that everyone sees it. So those are the only ones that by default will put on global. So everyone will see that the client exists in most projects. Then if you're a coordinated entry project, then we'll add these visibilities. That is that if you are a family housing hub, project or a single adult coordinated entry project, you'll have visibility. That generally is the only way you'll have visibility. So things like file attachments don't share outside of your particular project unless you request them. Coordinated entry projects, those will share. Otherwise, those are not shared. Another thing that has come up in user issues recently, I've had a few conversations about this one. I'm going to pop over here, is in coordinated entry. So what we quite often get is an EDA error. Many of our errors in visibility come from either an incorrect entry here, that is something that should be shared, is not shared, or something that is not something that a project or agency does not want shared is shared, and will make adjustments accordingly. The other thing that comes up from EDA, as you can see where this is on a coordinated entry project. So I created this. I created this fake user here in the training environment. And what should happen is my name should be available in user added. The reason it's not available, the reason it's hidden, is because I didn't EDA correctly. By not EDAing to a coordinated entry project, and you can see it here, this is the only place, because start date comes up in many other places. You can see that I am the user that created this entry. Otherwise, it's hidden. Not only is it hidden from visibility of just a quick look to see who's created, it'll also be hidden from other agencies, projects. So even though you went through the work of creating all of this data, it will be not visible to everyone that should have visibility. This is an issue that actually came up recently. And yes, I'm using CBI as an example, but this is not CBI directed. This is just an example of what happens when you don't EDA correctly. All of this will not be visible because of EDA. One of the issues with visibility and EDAing is our projects are set up to share only with those projects that have visibility. So if you're in a project that doesn't have shared visibility, you that is some agencies or some projects won't see what you've entered. And in fact, actually, some projects within your own agency may not be able to have visibility. For some case managers, that includes your supervisors, your agency admins won't be able to see the good work that a case manager has entered. And I'm going to stop the share there. We can go back to the slide. Thank you. So another issue is client profile is locked. I'm not going to go too much into that. Quite simply, we don't want anyone poking around in client locks, because while that cause a lot of trouble, please ask HMIS support to unlock or lock a client according to that visibility. So it's better that you ask the question, why can I not see this? And HMIS support will happily look into it and figure out if we can unlock a client. That being said, we constantly remind you, don't forget the ROI. If the ROI is not entered as soon as possible, anything prior to that ROI being entered may not be visible. That is, if you enter a client on November 1st, but you don't enter the ROI until November 28th, some projects may not be able to see some of the data because of that visibility that I showed you, such as file attachments. They won't be able to see because you didn't enter the ROI and we didn't set it up. We didn't open it up until well after. So that's the most important things you can do. Making sure first that your EDA is correct. If the EDA is correct, please contact us at HMIS support and we'll look into other visibility issues that may come within the project setup. Top level providers, we've made some adjustments. So most users out that are not agency administrators do not have the HMIS level access anymore. That is, they'll have a list of projects, but not the HMIS top level project. So they should be EDAing directly to their commonly used projects. Again, if you see those problems, submit a ticket. Let HMIS team review the user, the client, and the provider setup for any issues and how to proceed. That's all I have. Any questions?
You guys able to hear me now?
Yes.
Cool. Sorry about my microphone technical issues later. My name is Curtis Hahn and I'm a business analyst. I'm going to be covering some of our federal reports that are actually ongoing and upcoming very soon. The first one is the Longitudinal System Analysis, or the LSA. The current 2022-2023 LSA is ongoing. The LSA is ran by the HMIS team and submitted by the HMIS team and does not require users to run any reports. The HMIS team may have already and may still reach out to agency admins with questions or clients to review for accuracy. So when we encounter an error that we're not able to figure out or correct, we may contact you to say, hey, can you review this client or review this provider to make sure that the unit info is correct, or how is this family supposed to be set up? We trust you that you're going to be the experts to know each situation, or have a member on your team who are able to answer those questions. Some of the primary issues that we run into in the LSA and that you can be aware of year round to ensure the best data quality in our system is head of household errors. And that's making sure that we always have one and only one head of household for every entry. And also ensuring that every client has a relationship to the head of household. Incorrect entries, often these occur when adding a client such as a baby to a family that's already been entered into a project. And when adding clients to a new entry or an already existing entry, always add the client to the original entry and then edit the entry date of only the new client to match when they actually entered the project. One of the other errors we find and have to correct are location errors. And this is the client location pictured below. For Maricopa County, it's going to be AZ 502. And for balance of state, it's AZ 500. Make sure that that data is always recorded when entering a client. For the vast majority of clients, it'll already be there. So it's easy to forget or easy not to check, but making sure that that's entered helps us out and really alleviates some of the pain that we experience trying to correct errors and get everything up to date so that we submit the best quality reports to the federal government. The next slide, we're going to cover the HIC PIT. As we mentioned earlier, the 2023 HIC PIT is upcoming. Something to really look forward to in January as to start the year, because it's definitely not a frustrating pain point for anyone. The HIC PIT is a collaborative effort of agencies, the COC, and our HMIS team. The COC leads the PIT count and really sets the dates for when we'll be recording the point in time count. The HMIS team reviews inventory data and ensures the accuracy of reporting. Agencies will be running the 0628 and 0630 inventory count and point in time count reports for all temporary and permanent housing projects, respectively. We have some tentative HIC PIT dates already set. So for Maricopa County, it'll be on January 24th, 2022. Balance of state is still TBD, but the date will most likely be around the same time as Maricopa. What you can be doing to prepare as you get ready for January, when things sort of get urgent and we need a lot of this stuff done pretty quickly and there's a fast turnaround. Be ready and make a plan to run the 0628 and 0630 reports in late January. confirm that all the housing projects, bed and unit inventories are accurate. Request to close any projects that are no longer in use or will be closing before the night of the HIC pit. Expect and look for more communication on the HIC pit process and instructions for completing your agency's reporting requirements. In December, we'll be talking about a lot of this in our agency admin training webinar, and I'm sure there'll be additional communication, emails, and other information sent out in between now and then especially after that agency admin training webinar.
Okay, I will be going over auditor accounts. So in order to request an auditor account, we have a new user packet for auditor accounts. It's separate on our website from our original new user packet. So please submit this packet when you have an auditor visiting your agency that needs to log into HMIS and view your agency's information. And please include whether they are audit only, whether they will generate reports, and what projects they'll have access to, and the anticipated time and dates the auditors intend to complete the audit. And then for tickets, we wanted to point out an ethics violation, and we wanted to remind you to never include personal identifiable information in the ticketing portal. So it's an ethics violation to include a client's PII in the issue description. Never include their name, date of birth, or social security number. Attachments with PII are acceptable, however. And make sure you're always providing detailed information in the issue description as long as it doesn't have PII. Please include relevant project name or ID or report name. Please include the relevant client ID if applicable, and describe the issue you are experiencing. So to the right, we have a screenshot that has an example of an incorrect way to submit a client merge ticket and a correct way. Please only use the client ID when referring to clients. So now we'll do a break for questions. So this is a great time to ask any questions in the Q&A. And Amber asked, did I hear you correctly when you said the project should be included on a merge ticket? And no, actually the project ID, any project ID doesn't need to be included in a client merge ticket. We were just using client merge as an example for not including PII, but client merges, yeah, the project ID isn't relevant for that ticket. So that's okay not to include that.
Organizations update their contact information on an annual and or change basis. If there are interim changes that transpire during the duration of a year, they'll send their updated contact information. If you're trying to get in contact with an organization or an agency and you have incorrect information, let us know and we can direct you appropriately if you have outdated contact information.
All right, I see one more question from, for Stacy. I was just about to say that she asked how often should committed agencies renew their agency commitments within their local coalition to end homelessness, or LCEH. And I would just check with your LCEH, and I think that would be more of an LCEH governance piece, and I'm not exactly sure what the time frame is for that. So I would check with your LCEH, but let us know if you have any issues getting that information, and we can reach out to ADO directly. All right, I'm not seeing any more questions.
Okay, so thank you so much for joining us today. Your feedback is very important to us. We'll be sending out a satisfaction survey within 30 minutes after this is ended to your emails, so look out for that. And if your question was not answered, please submit a ticket to the help desk, and have a great day. Thank you.
Thank you, everyone.